Hello, hello, come on in, come on in. Are you here for your cranial nerve exam? Alright, perfect. Well, you're right on time, so let's get started. So today I will be performing your cranial nerve exam, and I just want to make sure that you're checked in first. Always forget that step. So first let me check you in the system. Okay. What did you say your first name was? Paula. Alright. I think I found you. What's your last name, sorry? Can you spell that for me? Louise, right? Louise? Okay. And what's your address? 337561114. Okay, I think I see you here. Perfect. Okay, so you're all checked in. I'm gonna put this aside. Alright, so first things first, I'm gonna be asking you a few questions. And then once I have all those answers from you, we will decide my course of action for this test for you. Is this your first time here at the clinic? Yeah. I think I've seen you before, but I do see a lot of patients every day, so I'm not 100%. Because your name does ring a bell. Paula, right? Yeah. Okay, so I'm gonna put your first name here. Okay. Yeah, I think if I refer back, I can see that you were in last year in September, I guess. Yeah, I see you here. How have you been? Yeah? Good, good. Awesome. Alright, so your last name, Louise. Amazing. And can I also get your date of birth, please? November 14th, 19. Alright, and can I also ask, who's your family doctor here? Like, do you have a family doctor? Okay. What's their name? Dr. Ryan. Is this the one on Appleby line? I think I see a lot of patients who go to that doctor. That's interesting. Yeah. I think, yeah, because I've heard that name quite a lot before. Perfect. And what else do I need from you? Okay, I do need to know if you wear any contact lenses or spectacles. You too? Both? Yeah, that's important. And when was the last time you got your eye number tested? What was it? 2 months ago. Okay. No, the reason I ask is because usually when people come for eye tests, they've had their eye tests, cranial nerve, they've had their eye test done very recently. So it's been a couple of months for you, right? Okay, that's not a problem. That's okay. Yeah. Another thing I want to ask you, do you have any allergies or any irritation in and around your eyes? Sometimes? Oh, that's not good. What kind of irritation do you feel? Itching or burning or both? That's not good. No, we're gonna get that tested today. Yeah, that's good that you came in. No, I know. A lot of people just let go of it and wait for it to pass unless it gets very serious. So it's good that you're taking care of yourself. Okay, I think I have all the information I need. I'm going to take notes alongside while I'm doing your test, just to make sure that I have everything written down, okay? Yeah, for future reference as well as for my own diagnosis. Yeah, perfect. Okay. So let's get started. I hope you're feeling relaxed. Yeah, I want you to relax. This is a safe space for you. And you're my first patient ever. So I'm gonna make sure I take care of you, okay? Alright, so first things first, I'm going to put on my gloves because I want to make sure that I'm not passing on any infections to you. Even though my clinic is super clean and hygienic, I just want to make sure that I still am using my gloves. Alright, perfect. So what I'm going to do is I'm going to clean your eyes first because I want to make sure that I'm not testing on dirty eyes, you know what I mean? I'm going to use this spray. Perfect. I'm going to gently wipe your eyes. Okay, I think I left a bit of a mark here. The left eyes as well. Okay, good. Yeah, 100%. Hygiene first, you know. It's important for me to make sure that you don't get any infections here because I see a lot of patients. Alright, I'm going to be taking your vitals. So, I'm going to be using this thermometer. Just want you to open your mouth and put this under your tongue for me. There you go. Ah. Yeah, just right there. Perfect. And while you are doing that, I'm gonna make some notes. Alright, I think that's done. Okay, that looks good. 98.6 and no fever. So we gotta check that as well. Next thing I'm gonna do is I want to take your height. I have this device to check your height. If you could just stand there for me. Okay, and then to your shoulder like that. Alright, perfect. So you are 160 centimeter tall. That's a good height. If you could just stand there on the weighing machine. I want to test and check your weight. Yeah, just right there. And don't worry about it. All of the information that I'm taking from you is going to be confidential. Okay? That's awesome. Yeah. Yeah, it comes under PHI, patient health information. You're not supposed to disclose anything because obviously, you know. But you relax and calm down. There's nothing to worry about. Alright, get your weight here in kilograms because we do metric. Alright, the vitals look fine. So I'm gonna start off by just checking your vision. So what I'm gonna do is I'm gonna be using my 2 fingers. You just have to let me know when my fingers go out of the screen, like your vision. When you see the fingers go out of your vision, yeah. Alright, are you ready? Okay. 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 Good. Good. Perfect. Just gonna make a note of that. Yeah. It looks good so far. You're doing great, by the way. Okay, so I'm gonna be using my fingers again. You just have to focus on my nose and tell me what number am I holding up. And for that, I need to close your right eye and then left eye. So I'm gonna start with your right eye first. Alright. What number is this? Okay, this. Good. 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 Now let's do your next eye. So I'm gonna be closing your left eye this time. What number is this? Okay. What number is this again? Yeah, 3. Correct. Okay, good. I'm gonna take that down just for my future reference. You did good on this as well. Yeah, perfect, Paula. You're doing good. The next thing that I'm gonna do is a color test, okay? So I'm gonna show you a bunch of phone covers and you just have to tell me what color is that, okay? What color is this? Yeah, it's a shade of white. I'll give you that. What about this? Okay. What about this? Yep, good. What about this? Yep. What about this? Purple, you're right. What about this? Okay. And what about this color? Okay, good. Not bad at all. I think you only got 1 wrong, but I wouldn't blame you for that because it was very close. Okay, so color test passed. Sorry, did you have a question for me? Yeah, that is actually important to see if you're able to recognize colors, because sometimes you can go color blind and you don't really realize it until you get tested. Yeah, that's the reason why we do color test. Alright, let me make a note of that. Oh, you're doing good. I do have a few more colors that I want to show you. They are going to be tricky because I do have shades of similar color. So just want to get a little bit deep and make sure that you're able to differentiate between colors. Right? What color is this? The cap of the pen. And what color is this? Yeah, very good. What about this? Good job. What about this? And what about this? Good job. What about this? Yeah, that's correct. And this. Alright, that was my last color test. You're absolutely not colorblind, so that's good. Yeah, we just have to rule that out as well. It's a part of the cranial nerve exam. Alright. So the next thing I'm going to do is a light test for you. I just want to let you know that I will be holding a flashlight just to test the movements in your eyes. So it can get a little bit bright for you, but it's important for me to test you, okay? Are you okay with that? Are you ready? Okay, great. Just look straight ahead for me. Alright, okay, the other side. Alright, good. Just a little bit more. Alright, to the left maybe. Yeah, that's good. Okay. Look up for me. Look up. Look down. Look to your left. Look to your right. Alright, that's good. Yeah, I just wanted to make sure that your pupils are reacting, because they expand and they contract when they come in contact with the light. So far so good, but I do have one more light test for you. Just give me 1 second. Yeah, I just have to make the notes, you know. It was helpful that you reminded me you were here before, because I'm able to refer those notes in this examination for you. Yeah, it's always helpful to make notes. Nothing better than handmade notes though. Alright, so one more eye exam. This time I want you to rotate your pupil. Yeah, like 360 degree, go up, left, down, right, and then back up, okay? Yeah, I just want to check something. So again, it's going to be right. I just want to get a bit closer to you as well. Okay, this is good. Okay, yeah, keep going. Circular motion, please, for me. Circular motion, please. Yeah, that's good. I know it's probably hurting a little bit, but just keep going for another 30 seconds, please. Okay. Yeah, that's good. Okay, yeah. That's good. You're doing great. Awesome. Okay, let me see here. Now I think your eye is getting projected on my monitor. So I'm gonna keep looking and wanna make sure that I'm getting the right numbers. Okay. That's perfect. You did amazing. Good job. Time to take notes. Yeah, everything looks good so far. I just want to check in with you and see if you're doing okay. Are you relaxed? Okay, I'm just gonna give you a stress ball now. I want you to squeeze on it as hard as you can, like with all your power. Just want you to squeeze on it for me. Yeah, just do it. Maybe do it 5 times. Yeah, that's good. In the meantime, I'm gonna measure your eyes. Want to make sure that they are in sync. So I'm gonna use this device just to do that. Okay, just look straight ahead. No, don't move your face. Just stay still, please. Stay still, stay still. Yeah, I just want to make sure that this little droplet comes in the middle. And there you go. That's awesome. Alright, I'm gonna be using this. This is very light. It's for medical purposes. So what I'm gonna do is I'm gonna be using this, and I'm going to be pounding on either side of your eyes, on this side as well as on this side. It won't hurt you, I promise. I've done that before several times. Even though I said you're my first patient, I've done that on my siblings before. I'm just joking. You'll be fine, okay? Okay, I'm gonna start with your right hand side. Yeah, see, told you it won't hurt. Okay, on your left now. How does it feel? Did you feel any irritation? Did you feel any aches? You did, okay. And what kind of irritation was it? Was it a constant pounding pain, or was it more like a migraine sort of? Okay. Alright. That's good to know. Basically, we're done with the eye test. I just have to make sure that your nose is okay as well. So I'm gonna do a smell test real quick, and then you're good to go. Yeah, but for your eyes, before anything, I just want to put these droplets, eye drops. Yeah, I think these will be good for your eyes. Yeah, these are the ones that I usually use for patients with irritation and whatnot around their eyes. I just want you to open your eyes for me, the left one first. Okay, the right one. Oh, good. That's good. Okay. So the last thing that we are going to do is a smell test. I just want to make sure that you're... Yeah, it's important for us to do that. Yeah, I do it for all my patients. So it's going to be really strong. I'm going to be using a inhaler. This is an inhaler I got it from one of my friends, got it from Thailand, and it's really, really strong. So we start with that because it's more possible that people can smell it. So I'm gonna open it. Oh my god, it puts me to sleep every time I smell it. I think it has some like natural herbs, including, oh my god, it's so good. Yeah, I think it also includes camphor and menthol. It helps you with dizziness and any cold and all those symptoms. So would you go ahead and take a sniff for me? Yeah, go ahead. Yeah, take a deep breath, like a deep breath. Another one, please. please. Okay, good. Yeah, I told you it's really strong. Alright, now to make it up for that, I have a very nice candle, very nice smelling candle. I would want you to smell that for me and tell me, what do you smell? Oh, it's amazing. Go ahead, take a sniff. Yes, that's mango vanilla. Your smell is perfect. You have no issues there. And there is one last candle that I would like for you to smell. Okay. I'm going to show you what flavor this is, but if you guess this one correct, then I won't charge you for this cranial nerve exam. Okay, you ready? This is my favorite smell. Go ahead, take a sniff. What do you think this is? You're very close. Yeah, it smells a bit like coffee, but be a little more specific. Good job, you're right. This is salted caramel mocha flavor. I have not yet burned this candle or lit this candle because I don't want to use it. You know what I mean? Because then once I start using it, it'll be gone because I'll use it every day. Because I know myself, I'm a sucker for candles, so I'm kind of saving that one just to sniff it once in a while. Do you do that too? Oh my god. Yeah? What's your favorite smell? Okay. Alright. And the last thing that I want you to smell for me are these incense sticks. Go ahead, take a sniff for me. Yep, go ahead, take another sniff for me. Perfect. Do you smell it okay? Okay, good. So I think the burning and itching around your eyes, yeah, it seemed very mild, and I don't think there is anything to worry about. Yeah, so what I'm gonna do is I'll write you a prescription. You can take that to this nearest pharmacist and just use it maybe twice a day. Yeah, and I think if it doesn't go away, then you just come back to me and take a look again, okay? Yeah. Okay. Here's your prescription. Okay, well, this was good. Thank you for coming to my clinic today. If you have any questions, you can always call my assistant, or you can even email me. And once I have more time, because I'm seeing patients almost every day, all day, I'll get back to you, okay? Okay, bye.